Our Cadsoris pump. This we're using for our PCA and epidural. So I will show to you how we are programming this pump, how to program, and then how to change the cassette if it is needs to be changed for new one. So the power on, power off is on the other side. Okay, this is how we are programming. And this is our key. Almost all wards you have your own key. Okay, so we need to put to our clamp just to hang. And this is our medication. This is for the PCA. This is all from the pharmacy. So after checking all the patient's rights to medication with correct label, we need to connect to our pump. Before we will connect to our pump, we will need to check for the air. So from the pharmacy, after checking everything, we need to get the sterile syringe. Some of the pharmacies, they are removing the air nicely. But for others, so they don't care, it is our responsibility to remove the air. Sometimes there are some small bubbles or even a very big amount of air. So what we will do with the sterile syringe, we can introduce little air, sterile technique, after removing the cover. Okay? So if it has a green clip, what we will do, we will just press this one, the green. And then the position of our cassette, this is the hook. This should be down part or 45 degrees or slanting position. Syringe empty is ready. Just to introduce air, to press this green again. Introduce little air. And then air is there. If there's small bubbles, we need to tap our cassette. Or to do like this, so that the small bubbles will become bigger. It will be easy to aspirate. How to remove the air? Again, this hook is very important, down part. Position your cassette slanting or down, because all the air will be on this side. The opening going to the cassette or to the plastic inside is here, aside from here. So slanting, all air on this part. Press the green again, and then start to aspirate. We are removing only the air, not the medication. Okay? Sometimes there are still extra air or bubbles inside. What we will do, we can repeat our procedure. Introduce little air. You can tap lightly, or you can do like this, and then aspirate. If you didn't see any air inside or even small bubbles, it is ready to connect to our pump. How to connect to our pump? We can tilt like this. And then again, this hook is very important. We need to hook. You can see the 2-hinge pin. All the 2 small aluminum bar at the base of our pump. We will hook it there. And then, just try to position. Check if our clamp is open. If it is not open, we need to open with our key. Just insert on the side, twist, and then press the latch down. If it is down, you can keep your key at the side. Press the latch fully down. And then that is the time you will push the cassette up. Be sure it is fixed well. Okay? And then if it is fixed well, while pushing the cassette up, your finger or your hand is on the latch, pressing it down. And then remove your finger from the latch, but still supporting your finger or your hand by pressing the cassette up, so that it will be fixed well. And then press the latch up. Sometimes it is difficult to press the latch up. What you will do, remove the cassette again and refix. How to remove the cassette? Just simply press the latch fully down and then reattach. Hook again to the hinge pin. Press the latch fully down. Push the cassette up. Fixed well. Remove your finger from the latch. Press the latch up. So it's easy to press up. And then don't forget to lock with our key after pressing the latch up. And then the first message on our pump, this is programming. Do you want to start new patient? Of course, we need to. So just press yes. And then if the order is for PCA, select the therapy, arrow down to PCA. And then PCA highlighted, just press select. There's two qualifier between adult and pedia. For example, our patient is adult. The first one highlighted, it is adult. Just press select. And then our drug to be selected. If the order is morphine, for example, we will choose the morphine by pressing the arrow down. Morphine is highlighted. It is 1 milligram per ml. Just press select. And then we need to enter the code. Our code is 201. So how to enter the code? Just press arrow up 2 times. Number 2 will appear. To move to the second digit, just press select. 0 is already there. Then we will move to the third digit by pressing select again. And then press arrow up. Number 1 will appear. We enter the correct code 201. And then press accept value. And then after that one, your pump is asking, are those correct? We need to counter check. Our therapy is for IVPCA. Our qualifier is for the adult. And then our drug as ordered is morphine. And then our unit is ml. We're keeping all PCA and epidural ml as a unit. Okay, everything is correct. Just press yes. Our pump is programming. And then next, review pump setting. We need to review. So, only one option. Just press review. And then continuous rate is 0. Our pump is pre-programmed with some numbers. So, upon orders by anesthesiologist or pain management in the Isahi, we need to correct. So, usually with continuous rate, all the time it is 0 unless ordered. So, for example, this is only for post-op patient. Continuous rate 0, that is correct. Just press accept value. There's a green check beside. It means what was programmed on the pump and then on the order in the Isahi is the same. It moves to down. PCA dose. For example, our dose is 1.5 as ordered. We can change this one. How to change? PCA dose highlighted. Just simply press select. And then it will show PCA dose 1 ml. The ordered is 1.5. How we can change? Just press arrow up until it will be reached 1.5. Okay. This already 1.5. The option to save, just press save. So it's saving the 1.5 dose. That is correct as ordered. Just press accept value. There's a green check beside. It moves down to lockout. So what if the lockout is 5 minutes? On our pump, it is 6. We can change this one again, just to repeat, by pressing select. And then move down to 5. Pressing arrow down. So our lockout, this is 5 minutes. That is correct. Just press save. Here is the save. It's saving the new lockout 5 minutes. That is correct. Just press accept value. Another green check at the side. It moves down to 1 hour limit. So our dose is 1.5. Our lockout is 5 minutes. We need to enter the correct 1 hour limit. We have formula for 1 hour limit. 60, that is constant. In 1 hour, we have 60 minutes. We need to divide it by the lockout. And then multiply with the dose. So 60 divide 1.5 is equals 18. And then 60 divide 5 is 18. Multiply with 1.5 equals to 18. Okay? And then we need to program with 1 hour limit as 18. So just press select and then move up to 18. So our 1 hour limit is 18. That is already correct. Just press confirm. Sometimes it will show that you need to override because this pump is pre-programmed, and then we put on the system only 12 ml, the maximum. Since we increase the dose, it becomes more than the 12. That's why the pump will ask to counter check whether you are agree that the patient can receive 18 ml maximum in 1 hour. Upon order and then upon assessing the patient, they can receive this one. So we need to override the 1 hour limit by pressing yes. So just press yes. It's override. And then it's saving the 1 hour limit, which is 18. So press again the accept value. There's a green check. It moves down to reserva volume. So if our order of our cassette is 100 ml, it's a bigger cassette, we need to change the reserva. So again, reserva volume highlighted, just press select and then move up to 100 ml. If it is 30 ml cassette or as ordered, just move to down by pressing arrow down. Since our cassette is 100 ml, the order is 100 ml total volume, just press arrow up until 100. Okay, you can press and hold the arrow up, but you need to watch out the number. It might be increased quickly. Okay, 100 ml reservoir. Just press save. Saving 100 ml. Press accept value. All our parameters with green check. It means it is the same what was ordered on the system. And then, the option only is between exit and next. So we will press the next so that we can proceed. Okay, and then prime tubing. So our tubing, so this is our tubing. When you prime this one initially, this is approximately 2 to 3 ml. So how we will fix this one? So it has of course two ends. This one without the other access, the bigger one, smaller. This is the one we will connect here to the cassette. This is the proper way. And then it is ready to prime. So prime tubing is the option on the pump. This is new cassette, new tubing. So we'll just press yes to prime. Counter checking, the pump will remind you, disconnect tubing from patient. Open clamps, then press prime. Because sometimes if we are busy, we are in a hurry, sometimes we miss to prime and then we connect to the patient. So this is the reminder. So for this one, not yet connected to the patient, ready to prime, just press prime. So it is priming. Check where is the medication. Approximately again, just to repeat, 2 to 3 ml. Or sometimes if there is some air or bubbles, maybe it can be more than 3 ml. Okay, it's near. We can clamp this one. There are some extra air. Okay. If it's already primed, don't forget to press stop. Otherwise, we will waste our narcotic. After that one, just check on the screen. It says we prime almost 3.4 ml. Continue priming. No need to continue. Everything is primed. No extra air or bubbles. So option, no and yes. The question is continue priming, so just press no. Asking you to start pump, so ready to start pump, so just press yes. So our pump is ready to connect to the patient. This is the patient's IV line as for the PCA. Okay.